Okay. Dear colleagues, dear attendees, thank you for joining this webinar, which is dedicated for networking among Central Eastern Europe and former Soviet Union health researchers, especially in health policy and systems field. I'm George Gutsadze, I'm head of the Kuratio International Foundation based in Georgia, and we're delivering this webinar in close partnership with Health System Global, that is very close to our heart, as we've been hosting the Secretariat for Health Systems Global since 2015 up until 2020. Now, please allow me to introduce the objectives for today's meeting. So we wanted to organize this webinar in order to trigger the interest of networking among the researchers working in former Soviet states, as well as in Central and Eastern Europe, primarily because as we run the Health Systems Global in past years, we failed to increase the membership in Health Systems Global, as well as networking opportunities for the researchers from this underrepresented region, if I may use this word. So therefore, we hope that as a result of today's event, we will establish closer professional links, and we will be able to identify many opportunities where, across the borders, our researchers could work together and deliver the great benefit to our societies that we live in. So on that note, please allow me to introduce the first speaker of our webinar, who is Professor Tolib Mirzove, close friend and good colleague of ours. Professor Mirzove he's a professor of global health and policy in the Department of the Global Health and Development at London School of Hygiene and Tropical Medicine, and his expertise covers three broad areas. The first is the health policy, the second is the health systems, and third, that he loves so much, is the capacity strengthening, and that's probably what he will be speaking today. His research is primarily in South Asia and Sub-Saharan Africa, and before joining London School of Hygiene and Tropical Medicine in 2021, he was based at University of Leeds as a visiting professor and had worked a lot with the governments and non-governmental organizations under different funding agencies. But most importantly, Professor Mirzove is an elected member of the Board of Directors of the Health Systems Global and fellow at UK Higher Education Academy in UK. So he brings substantial teaching, guest lecturing, and external examining and mentoring experience. And on that note, with a great pleasure, dear Tolib, I invite you to speak to our participants. Over to you, Tolib.
No, thank you very much, George. It's a privilege and a pleasure to be with you, and thank you for inviting me. I think for this webinar, I am speaking in my capacity as a vice chair of the board of the Health Systems Global. And in the next kind of 15 minutes or so, I will give you a sense what the HSG is about, perhaps with apologies to colleagues who are already very deeply ingrained within the fabric of the society and already know quite a lot, but maybe that would be a useful refresher. Next slide, please. So the Health Systems Global is a membership-only society that connects the health systems researchers, policymakers, and practitioner communities, and contributes to the attainment of better health, equity, and well-being. So next slide, please. So we underpinned, our activities are underpinned by the 5-year strategic plans. So the current period focuses on 2022 to 26. And our overall mission is kind of reflected in the description that I already given earlier. So it's to support the health systems to attain better health, equity, and well-being by strengthening the field of health policy and systems research and policy and practice communities. And our mission, our collective vision is to, as a network, we connect and engage researchers, policymakers, healthcare managers, educators, civil society organizations, media, and the funders from across the globe to advance the field of health policy and systems research, and create also opportunities for unleashing what we call the collective capacity for generating, sharing, and applying knowledge necessary for health system strengthening. So ingrained in our vision and mission is the kind of the multi-community perspective. So even though we are advancing the field of health policy and systems research, our members include diverse communities of practitioners, policymakers, and funders. Next slide, please. So we are underpinned by 5 fundamental values. So first is equity, diversity, and inclusiveness in our membership, in our governance, operations, and activities. And this is where I particularly would like to acknowledge Croatia International, who have really set up the excellent platform and by being the secretariat of the Health Systems Global in the last period. And that has been kind of carried forward by the current and future secretariats. So our second value is engagement and participation of diverse membership, comprising researchers and non-academic communities as well. Third value is being innovative and catalytic, constantly experimenting and learning from the actions. Fourthly, we would like to lead through partnerships with international, regional, national, and local groups to ensure relevance of our work to the key communities that we serve. And fifth, and not last, is the accountability and transparency in our kind of governance and operations. Next slide, please. So we currently comprise just over 1,200 members worldwide, and the numbers have dropped slightly, as you would expect during the COVID era, but we are kind of rebuilding the membership base. Hence, one of the objectives of this webinar. And as you can see from the breakdown, I think the Europe and Central Asia is about 3rd largest category. In many ways, it's actually dominated by kind of communities of researchers and practitioners who serve the the needs of the low and middle income countries. So we would really like to kind of expand the membership base into the Eastern Europe and Central Asia, and capture the huge potential and huge intellectual and capacity assets available within the region. Next slide, please. So we offer our members, but also wider communities, huge amount of opportunities to get involved and contribute to the field of health policy and systems research, and also advance the field. Next slide, please. One of our core kind of backbones of the society are what we call thematic working groups. So these are multidisciplinary groupings that provide platform for discussion and exchange on issues of relevance to the health policy and systems research, or HPSR. Next slide, please. So at the moment, we have 10 thematic working groups, which are listed on the right-hand side of the slide. So they capture the issues which our community of members feel there is priority, but also where there are common and shared interests and drive to take the issues forward. So these include climate resilient systems, fragile and conflict affected states, accountability and anti-corruption, private sector, community health workers, emerging voices, ethics and justice, social science approaches to health policy and systems research, teaching and learning, and translating evidence into action. So each of these thematic work groups is a very active community with lots of engagements. And indeed, this webinar is organized by the Europe Health Regional Network in collaboration with Croatia International. Next slide, please. Our regional networks are kind of another mode of interaction within the society. So they essentially facilitate engagement, knowledge exchange, and mutual learning on HPSR within and across the different regions, hence the name, regional networks. At the moment, we have got 5 regional networks. And as I mentioned earlier, this webinar is organized by the Europe Regional Network, which is led by Dr. Goran Zangana, who is one of the panelists, will be coming in later in the webinar. And the regional networks also kind of generate spaces to convene and collaborate with national and regional partners and working towards the advancing the HPSR field. Next slide, please. Another key feature of our work is the biennial symposia on health systems research, which essentially are the largest gathering on health systems research across the globe. Next slide, please. This quote essentially kind of summarizes what the symposia are about from one of the delegates of the Health Systems Research Symposium in 2022 in Bogota. So they essentially facilitate the knowledge exchange, networking, and bring the communities together. Next slide, please. So these global symposia, they are rotated across the different regions of the world. So we are entering the the period of the 8th Global Symposium on Health Systems Research. So the previous symposia were held in Montreux first, then in Beijing, where the Health Systems Global was inaugurated. Then the symposia were held in Africa, in Cape Town, then in Vancouver, and the next, and in Bogota in 2022, in Dubai in 2020. And the next symposium will be held in Nagasaki in Japan. So the 8th Global HSR Symposium will be during the period of 18th to 22nd of November. And the main overarching theme for this symposium is building just and sustainable health systems, centering people and protecting the planet. So I would very much encourage you to keep an eye on news from the Health Systems Global and also a regional network and Curatio International, and do consider applying to the symposium with sharing your research and practice. Next slide, please. Capacity strengthening, as George mentioned, is a very kind of important area for the Health Systems Global, and also an area which is close to my heart. So it's a core area of focus for the society. We have numerous projects that focus on different aspects of strengthening individual, organizational, as well as the network level capacities. And one of those examples is a publication mentorship program for first-time women authors, which has been kind of implemented during the last 2-3 rounds already in collaboration with the Alliance for Health Policy and Systems Research and Health Policy and Planning Journal. Next slide, please. Our partners are many, and these are the kind of their logos. So the Alliance for Health Policy and Systems Research, which I mentioned earlier, is our founding partner and one of the core kind of supporters. But we're also, besides the Alliance, have funders. We have close links with international development agencies. And of course, we have very close relationships with different practitioners and universities, as well as the kind of publishers and academic journals. And they support, of course, and engage in HSR symposia by providing scholarships or representing and sharing their work. They support regional pre-conferences before the Health Systems Research Symposia at the global level. We try to organize the kind of the regional conferences. And also they support the different programs such as advocacy, mentorship, curriculum development, and publication mentorship program. Next slide, please. Please do consider joining us unless you're already a member. So this is one of the objectives of today's webinar. And the benefits of becoming an HSG member are multiple. So these are some of them. So it's not just about staying informed and supported, but also connecting, benefiting from this collective knowledge and then sort of benefiting from the exchange and interaction. And also some of the monetary benefits, for example, kind of reduction of the journal submission fees for the number of journals, as well as the access to the whole repository of resources. That is, most of them are open access, freely available, but some of the resources are for members only. Next slide, please. And this is the last slide. So we are on different platforms. So if you do have any further questions or would like to get some further information, please feel free to reach us by email, but also follow us on Facebook, Twitter. Well, now it's X or whatever is the new name for Twitter, LinkedIn. And those of you who are savvy enough can also scan the QR code, and that will take you straight to the HSG website. I will stop at this point, maybe invite any questions. If there are any questions, let me just check the chat, see if there are any immediate questions before we move on further.
Thank you, Toli. So we don't see the questions, and maybe this is the place where we should say that, dear participants, as a moderator of this webinar, I failed to say that there is a Q&A box and chat box where you could post your questions so our panelists could answer. So please use it effectively and engage with us. Secondly, there is an interpretation button because this webinar is delivered in 2 languages, in English and Russian. So if your preference is to listen into a Russian language, please use the interpretation button at the bottom. So, and you can join and listen in Russian. So sorry, Tolib, and over to you, back to you.
No, thank you very much, George. Yeah. Well, hopefully, colleagues were able to follow the contents. Of course, recording will be available afterwards, so you can listen at your own pace, but also share the links with further colleagues who couldn't make it during this time. I don't see any questions, so maybe we can, with your permission, George, we can swiftly go to the next step. And I think the next step is, and if there are any further questions, do drop them in the Q&A section, and either George or Goran or myself or Maya will provide the written answer in the Q&A section. But moving further, I think our next step is to actually gauge initial kind of involvements of colleagues in different kind of fora. So what we would like to do is to open up a quick poll, and please let us know if you are members of any other networks besides the HSG. So we try to keep the questions as simple as we can. Please vote. So we'll give maybe 20 seconds, 30 seconds, and then we'll close the poll afterwards. Okay. And in the meantime, please do drop your questions, which you may be kind of emerging in following the presentation. So at this point, I think let's just maybe wait for a few more minutes, a few more seconds, sorry. Okay, so George, should we close the poll maybe? I don't know if we can display the results for public use. And at this point, I will pass it on to you, to Professor Gotsadze. So George, back to you, please.
Thank you, Tolib. So Maya, just let us know. So if we're going to see the results of the poll, or should we be moving forward?
I guess we should move forward, George, and
okay.
maybe.
Let's move the forward while the poll results will be displayed later. So I have a pleasure to introduce our next speaker today, who is Dr. Goran Zangana. So, and he's, first of all, he's the European Regional Network Coordinator, board member of the Health Systems Global. And he's one of the inspirators as well as organizers of today's event, and striving hard to expand the network as broader as possible by engaging more researchers into the network. Dr. Zangana is a medical doctor with experience in acute medicine, public health, epidemiology, as well as health policy and health systems research, focusing on conflict-affecting settings. So he was a Fulbright Fellow in the US, doing his master's in the health policy at Emory University, and did his PhD in international public health and policy at the University of Edinburgh. Prior to joining HSG board, Dr. Zangana was a member of the governing board of the Emerging Voices. This is a subset or subgroup of the Health System Global, and he was also advisor of the thematic working group that Professor Mirzoev said about the fragile and conflict-affected states. So Dr. Zangana is an acting consultant in the acute medicine in the National Health Service Scotland, and also he's a global citizen champion at the NHS Scotland. So on that note, it's my pleasure to invite Dr. Zangana, who is at the hospital right now, but joined us to dedicate his time to expanding the network in Europe and former Soviet states. Dr. Zangana, over to you.
Thank you so much, Professor Gotsadze, and for that very generous introduction. I don't know if you see me. I'm assuming you see me in my scrubs. That's why. No, you can't see me. So let me see if I can fix this problem. But you can hear me. Yeah, I'm assuming you can hear me.
Yes, definitely, we can hear you.
Yeah. No, I don't know what's going on. Maybe it's the poor connection in the hospital, but I am really honored and excited to be here. And thank you so much for that very generous introduction, Professor Gotsadze. And thank you so much for Ms. Maya Ochashvili for her energy, her passion, her enthusiasm, and dedication to organize this webinar, as well as the wider activities around the network. And thank you to Professor Mirzoev for his fascinating introduction about Health System Global. I don't need any, I feel like I don't need to have any discussion around our society now with that fabulous and detailed presentation that Professor Mirzoev provided. But yeah, I wanted to just provide you some reflections, some personal reflections about my journey as a member of this exciting society, the Health System Global, that we are all proud members of, and also invite colleagues, researchers, policymakers, activists around the region in the former Soviet Union countries to join us and welcome them and be colleagues together and be partners together in our in our passion to be students of health systems and health policies, but also advocates for universal health coverage and a right to health and all of the exciting things that we are working on day in and day out. So I joined the society in 2020 during the first symposium that Professor Mirzoev was talking about in Mongo, and that is what excited me about this society. That was created and generated a lot of passion for me. The setting was beautiful, around the Geneva Lake, and that I think it was part of the reason. And then, as Professor Mirzoev was saying, we had global symposiums since every 2 years in a different country and a different setting. And I had I was fortunate enough to join most of those symposiums, except for the one in Beijing and Cape Town, which I regret very much. Because of personal and professional reasons. I was doing my PhD at the time and I was really busy. But the membership of the society provided me with an immense opportunity to engage with colleagues, with researchers, with world-class researchers who are doing cutting-edge research in health policy and systems research, but also policymakers around the world. I had the opportunity to meet with ministers of health, with members of parliaments, with other actors and stakeholders. Of course, international organizations, civil society, WHO, as Professor Mirzoev mentioned, we work very closely with the Alliance for Health Policy and System Research, which is hosted by WHO, and there has been a fantastic and amazing partner of us throughout our journey. But also, we've been working on a number of exciting aspects of health systems and policy research, and it doesn't only limits or restricted to healthcare. We work, as Professor Mirzoev was saying, and I'm sure as Professor Gutsadi was saying in his introduction, which I unfortunately missed in the beginning, we have a number of exciting thematic working groups. And I was fortunate enough to be part of the leadership of the very, very energetic and exciting thematic working group of the Emerging Voices for Global Health. And these are a number of very passionate, energetic, emerging what we call voices, newly graduated masters or PhD students who just either started or just finished their work, and they are so passionate about whatever they are working on, and they want to just go out there and change the world. And I was so fortunate to be an emerging voice myself in 2016 and participated in the Vancouver Symposium in Canada. And then I was elected a member of the governance board of the Emerging Voices, representing the Eastern Mediterranean, where I'm originally from. And also I was part of the fragile and conflict-affected health systems, because that was my interest in my PhD. But we also have a number of other exciting thematic working groups. We have a very, very active climate, resilient, and sustainable health systems thematic working group, and they are going to participate, actually, excitingly, in the next climate summit in Dubai. I forgot the name, Professor Mirzoev. What is it? It's called the it's a major international event that the United Nations is COP. Yeah, so the COP 28 is happening in Dubai, and our thematic working group hopefully will have a side event in that, in partnership again with the Alliance for Health Policy and System Research. We have the Fragile and Conflict-Affected Health Systems thematic working group again, which I'm a proud former advisor of, and they are very active. We actually did, again, with the help of the Kurasha Foundation and capable assistants, and Maya and George, a webinar, a very successful webinar on the conflict in Ukraine and its impact on the health system and health services there. We have an accountability and anti-corruption thematic working group, again, very, very active and organizing a number of webinars and activities around accountability and anti-corruption. We have a community health worker thematic working group, an ethics and justice thematic working group, a social science approach to health system and policy research, teaching and learning, translating evidence into action. So you name it, with aspects of health systems and policy you are interested, we have a group that you can start reaching out to colleagues. And I am here as the regional lead for Europe to help you navigate that, what might appear as a bit of complicated structure. But I reassure you that whatever it's your interest in health policy and health systems, whether you are a budding researcher, you are wanting to do research in the area, or you are an activist in the area, you are passionate about health systems that are affected by conflict, or you are interested in the right to health, or in learning and teaching, you want to organize a master's course in health system and health policy in your country or in your setting, please get in touch. I'm sure Maya can put our email addresses, or even our phone numbers, our Twitter, or as Professor Mirza said, our X platform, or LinkedIn contact information there. And please get in touch. We are more than happy to discuss your passion and your interest around health policy and systems, and it doesn't have to be research. Anything that you are interested linked to health policy and system. I'm in another capacity. I'm a co-chair of the advocacy working group of Health System Global, and as part of that, we are doing a lot of exciting work around the right to health, universal health coverage, and we actually just helped organize a side event at the high-level meeting of the United Nations General Assembly that's actually happening as we speak, or just happened in New York City. And one of our colleagues is actually participating in that event. And we have a number of tools that we are trying to implement in terms of advocacy through participation, advocacy through representation. One of the areas that I'm interested in is health workforce mobility. I know this might be an issue in your setting in the former Soviet countries in terms of health, in terms of the brain drain and health workforce migration. That is a massive interest for us, and we are interested in doctors and nurses who are looking into this issue. So what I'm trying to say is, I'm trying to excite you, I'm trying to energize you, trying to make you enthusiastic about our society. Please join our society. As Professor Mirzaev said, there is so many benefits of joining this exciting and amazing society. And I am here, and I'm sure other colleagues are here to answer any questions you might have, or any anxieties that might have in terms of joining, or any commitments that you think you might need to undertake if you are becoming a member. I am an example here. I can do acute medicine, and I'm a member of a very busy society as well. But there's a fantastic secretariat that is supporting us. So please join us, and please ask any questions that you might have. And I'm looking forward to answering any questions that you might have next. So yeah, that's me, Maya. Over to you.
Thank you, Goran.
Or George, sorry.
Thank you, no problem. Thank you so much for this introduction to you and to Talib. So I think we've covered the good ground about HSG networks, its uni-regional networks, as well as its thematic working groups. And definitely this is call for action to all our participants. Reach out through your network, please inform your colleagues that here is such entity as Health Systems Global, which provides numerous opportunities that might be beneficial for our colleagues working in this field. Now probably we'll move to another interesting topic of our webinar, which is what are their funding opportunities and what is the funding landscape where our researchers in our region primarily, but not only, could tap in to secure some research funding and allow not only like expanding the work that they are doing, but also like expanding the collaborative network, peer network that they might want to work with in order to learn more across the boundaries, as well as enrich their knowledge and professional capabilities through capacity building exercises, but also like through closer partnership with the peers. So our next speaker, and it's my pleasure to introduce like Maya Uchanishvili, who joined our foundation way back, almost over a decade ago, and now she's leading our research unit. She's the mastermind, along with Goran and Tolib, so behind this webinar, and also active contributor and organizer of this event, and she will be probably standing by there to receive your inquiries as well as be responsive to your needs. At the same time, what she does, she leads and is actively involved in finding and conceptualizing the new research opportunities, developing research proposals, identifying the research partners for our organization, and not only like that's why she's so interested to expand network in our region and make sure that we're linked professionally to more people as an institution, as individuals, as professionals, because we truly believe that our strengths lies in close partnership and collaboration. She's also responsible in preparation of many reports that also attract the attention of the different funders and different like media materials. She oversees the production of those media products like in our organization. Maya is also managing local and international internship program, which she has been running over a decade now at our organization, and she's responsible for strategic development of the research unit at Croatia International Foundation. So on that note, it's my pleasure to hand over to Maya for her presentation about the funding landscape of the research in our region. Over to you, Maya.
Thank you, George. Thank you for the introduction, and dear participants, thank you for being with us today and joining our discussion. Now I will try to talk about the landscape of funding opportunities in the global health, targeting, of course, opportunities for LMICs and for our region. One of the reasons of conducting the webinar today is the recognition of current situation in the health research in the region, especially highlighting the situation in the Eastern Europe and former Soviet states. So what are the current issues in the region, and especially in the health policy and systems research? So what we have seen that the main challenge is the low production of health research in general, and especially of HPSR. The one major contributor to the low production is the limited national funding available for HPSR in the region. Another challenge arises from the limited availability of research grants held by and led by researchers from the region. Also, we need to mention that there is a shortage of researchers and experts specializing in HPSR within the region. There are hardly any faculties or departments in universities within the region that focus on HPSR or global health and related fields. Also, we need to mention that there is also lack of awareness regarding available funding opportunities among researchers operating in the region, especially in the sub-regions such as Eastern Europe and South part of the Europe. And considering the last mentioned issue, we decided to give you a very general overview of available funding opportunities in global health. And most of them are targeting the LMICs, and might be useful for our audience today. So, of course, there might be different funding opportunities on a national, regional, and global level. But today we decided to share the information about a couple global health funding ones. Those programs are targeting global health issues with the specific target of low and middle income countries. So we will be speaking about Horizon Europe programs, we will be describing National Institute of Health Research UK funding opportunities, which might be relevant for the audience today. And we'll be also speaking about UK research and innovation. So let's start with the Horizon Europe. So Horizon Europe is the Europe Union's flagship research and innovation program for the period from 2021 till 2027. It is the successor of the previous Horizon program, which was so-called Horizon 2020. And the Horizon Europe is the world's largest research and innovation funding initiative. So the program aims to stimulate scientific excellence, to drive innovation and address societal challenges. It focuses on areas such as climate change, health, digitalization, and so on. And it's open for participants from EU members, for associated countries. The most of them are from the region which we are targeting today, for international partners and near neighborhood countries. So there is also a possibility for the wide range of applicants, the individual researchers, universities, research institutions, non-governmental sector, and even business can participate in the Horizon. Funding opportunities are available through calls of proposals and which cover wide range of research topics and activities, and applicants must submit their proposals in the response. Horizon Europe is organized into several thematic so-called clusters within the second pillar you see on the screen. So these clusters group research and innovation activities into thematic domains. There are 9 clusters available in the current program, and one of them is health cluster, which is most relevant for our community. The health cluster focuses on addressing key health-related challenges to promote research and innovation in healthcare and improve well-being of citizens. So the primary objective is to advance research innovation, and in particular emphasis on improving public health, healthcare systems, and well-being of citizens in general. Next slide, please. So the health cluster covers a wide range of research topics and areas. There are 6 destinations currently available, but I will not go through each. You will see them on the screen and the slides will be shared. But in case you will be interested to learn more about the Health Work Program, for 2023-24, the Health Work Program is open and available, and the links will be provided also along the slides. So you will have opportunity probably to select the most relevant calls for you. Well, speaking about the Horizon Europe, the main issue here is to develop and create the relevant and solid consortium. So if you will be thinking about to apply for Horizon Europe, you need to think about the partnership in parallel. Next slide, please. Another interesting kind of stream of Horizon Europe Framework Program is widening participation. It is designed to address disparities in research and innovation capacities across European Union countries and associated ones, and also near neighborhood countries. It aims to reduce the kind of innovation and research production divide between regions and countries in the region, and primarily targets countries that have historically received less funding from the Horizon program and have lower research capacities. This region and countries often include parts of Central, but mainly Eastern and South Europe and other less developed settings in the neighborhood countries. So the widening participation has different streams of funding mechanisms. I will share a couple. The first one is Open Facility, which is interesting opportunity. It allows researchers to jump in and engage with ongoing research projects already funded by the Horizon Framework Program. Another is Teaming, which aims to create and upgrade research centers in less developed regions by partnering with them and establishing high-performing institutions in less developed countries. The Twinning is more about collaboration between institutions, and only research institutions can participate. And the issue is that the less developed institutions should partner with two developed ones, and they are creating also possibility to increase the capacity. The ERA, it's about like more targeting the fellows, talents, chairs, individual opportunities, also aiming to attract outstanding researchers in the region and beyond by providing mainly funding to increase their research skill and also to establish and create the research programs. Of course, there are lots of many more to learn more about Horizon Europe, but hope you will have time and possibility to learn about relevant opportunities. And I do believe that widening participation pillar might be very interesting for the audience today, because it targets and creates an opportunity for the less funded countries and institutions. Next slide, please. So now I would like to switch to the UK funder, which is National Institute of Health Research. The NIHR has, of course, different type of funding opportunities for health research, but it has one which is might be interesting for us, so-called Global Health Research Program, which provides funding for research projects that aim to address global health challenges and improve healthcare in low middle income countries. And its primarily focuses to support high quality research, which can have positive impact to global health challenges and global health needs. NIHR have this global health research have different funding streams as well. So some of them are purely research oriented. Those grants support research that are aiming to generate new knowledge, evidence, and solutions. The others are targeting training and capacity needs, and they are more targeting in parallel with the research to increase and strengthen the research capacity and skills and expertise in LMICs. And NIHR Global Health also provides opportunities for individual fellowships, targeting individuals to conduct their global health research or to increase their individual skills. So NIHR Global Health funding cover a wide range of areas and themes related to global health, including infectious disease, non-communicables, maternal child health, health system strengthening, and health equity. So there is broad list to decide what type of research you are going to apply. On the slide, you can see a couple of calls available under this program. Of course, like you need to go into details for each one and select the most relevant for your organization or for your research idea. But if decided to go for NIHR call, we highly recommend to have UK partners on board. It will be benefit, and also to consider the local community needs, which is highly appreciated from the NIHR Global Health Board. That was briefly about the NIHR. Salome, please, next slide. So the next interesting opportunity is also funded from the UK, and it's UK Research and Innovation. Today we are targeting applied global health program, quite similar to the NIHR, but it also aims to address the global health challenges through collaborative research between UK and LMIC organizations. And the UK ERI Global Health Program supports research that targeting primarily and addressing the outcomes of health inequalities in LMICs. It also covers a wide range of research areas relevant to global health. Of course, health system strengthening is one of them, but the program also includes target topics within the Applied Global Health Research Program. It's maternal child health, adolescent health, early childhood development, and implementation science. Excuse me. So to conclude, I guess UKRI might be also a very good support to your research ideas, and same as in NIHR, please consider to have like partners from LMICs and from UK institutions as well. And next slide, please, Salman. And I guess like I tried to best bestly cover whatever was possible in dedicated 10 minutes for this presentation. But of course, each of you which will be interested to apply need to go through each call and see what is the most relevant for your ideas. And while working on this webinar and general thinking about this network of researchers, so we hope that as a result, we'll jointly increase the production of health research and the in particular health policy systems research in the region, and jointly we will try to increase the production of partnership type of research between not only between the Central Europe partners and Eastern partners, but from the Eastern and South partners as well. So I don't know, in case you will have some interesting research ideas, as colleagues already mentioned, please you can share them in our LinkedIn group. You can share it if you are or are going to become HSG member using the HSG networking channels, or simply you can, if you see us as a possible partner, or if you have some clarification questions, you can email us or directly contact us, the organizers and panelists of today's webinars. I have put some useful links by end of the slides. You will receive them. And thank you once again for your attention. Looking forward to your questions and hopefully to our collaboration. Thank you, Ovar.
Thank you, Maya. Thank you for this presentation. And before we hand over and start answering the questions, I had one question as you were presenting, so maybe for the benefit of our public and our participants. Could you just touch a little bit upon what is the eligibility to criteria for EC funding? And if you can highlight specifically like eligibility for organizations that are based outside of the European Union, and maybe even like not on a European continent, but even beyond. So like, what are usual eligibility requirements like for EU funding?
Okay, thank you, George. So it highly depends on what type of call we are talking about, but like mainly if we are talking about widening participation, it even targets organization outside the EU member countries to make them like willing to participate. If we're talking about the EC calls under the horizon, it depends on the call, but in general, like any research institution, public entities, even the business and non-governmental organizations can apply, but specific calls have their specific requirements. It's hard to like go through each. I don't know, Talib, if you have some in addition.
Just to clarify, so if I'm a researcher, not necessarily being in EU country, there are different calls that I could look at, not the fact I'm living on a European continent or maybe outside of European continent, I still have the opportunity to look at different calls, identify which allow me as an institution to participate, and then identify the respective partners that EU funding requires.
Yes, George. Okay. And especially those widening programs are even like targeting this kind of applications to have more participants, not only from the EU member countries, but from the associated and near neighborhood countries. There is a list available online and all the links will be provided so participants will be able to see if their countries fall under the near neighborhoods or associated ones.
Okay, great. So Tolib, you wanted to say something on this topic or no? Okay, then I have
No, thank you.
And Goran. So like if I'm interested, so like in the HSG, and if I want to become a member, so what specifically I should be doing? Like what will be your like 3 things that you would advise?
Okay. So I mean, the first thing to do is actually to become a member of our society. Please join the society, pay the fee, and join. And then next, we have a number of exciting ideas and opportunities. And as Maya mentioned, there are funding available, and we need to get our heads together and maybe work on a proposal, submit these proposals, and work on it together. But I think the membership, being a member of the society, is the initial first step. And then we have a massive list of colleagues, experts in different areas of research that we can access and ask their help. And as we mentioned, the thematic working group are full of experts in those areas who have not only expertise in their specific area of research, but also experience in applying to these grants and getting them. Some of them are MRC researchers and Wellcome Fellows, etc. So please join the society and then get in touch with us, with one of us, about any ideas that you might have, and we are more than happy to discuss them and help you with your applications.
Oh, that's great. So, Goran, if I'm a researcher in any country, so I have a deficiency in certain disciplinary areas, so I could reach out to HSG and search for a partner in this discipline that I have gap about, to identify if there might be an interest of partners joining me in my research, or like they help me finding the other partners that could support like me from across the board. So, or across the board.
Absolutely. And I think Professor Merzeev will have more examples about that because he's been working on very hard on capacity strengthening within the society. But I mean, as an example, just give you a recent example. We've been working on a number of issues in Europe, and one of them has been to try to have a pre-conference in Europe prior to the Global Symposium in Nagasaki 2024. Without going into much details of the details of the pre-conference, but we have ideas around the themes and the sub-themes of the pre-conference, and we can easily reach out to colleagues who are working on conflict, for example. We have, as I said, world-class experts in conflict-affected health systems in HSG who are very happy to help us, and they are engaging. We have colleagues who are experts in the climate and its impact on health systems, who are ready to help. So any topic you take, if you are interested in any topic, we have a member within the HSG membership, but also within the HSG leadership at the TWG level and the board level as well, colleagues who are when they can. Obviously, we are all volunteers within the society, but as much as our time allows, we are more than happy to engage in these activities. But it has to be within the structures of the society. It has to be linked to the society, and I think that's why I'm emphasizing the membership of the society as a first step toward any collaboration in this area. And I'm happy for, I think Professor Merzeev will have more to say about this. So I'm eager to hear his input into this as well.
Great. Tolu, before you jump on this, answering this question, one more on your list to consider. So if I'm a researcher and I'm methodologically challenged, like I live in a small country where like brain power is kind of very constrained, and disciplinary brain power is constrained at times when I'm doing my research. So if I'm methodologically challenged, could I come to HSG, and could HSG help me link with the colleagues who could advise me on like which methodology might best suit the topics I'm researching? So, and of course, the question that was posed to Goran. So it would be great to hear your thoughts.
Yeah, no, thank you very much, George and Goran. Maybe if I start with the second question, the short answer is absolutely yes. I think some of the TWGs, thematic working groups, they are specifically focused on topics, and some of the other TWGs, they focus on methods. For example, one of the 10 thematic working groups focuses on social sciences approaches to health policy and systems research. So by definition, it's a very methods driven. And by methods, we are kind of within each of the groups, we are very flexible. So we are a field of multidisciplinary researchers with economists and epidemiologists and social sciences researchers and so on. So we are harnessing this common potential and enhancing the the methods to advance the field of HPSR. So absolutely, and in some cases, methods are driven also by the topics as well. So, for example, there is a separate group on accountability and anti-corruption. So there are all these different sort of methods to reveal the covert behavior, for example, and in some of the hidden practices, which may not always be visible elsewhere in more traditional research areas. So absolutely, methods are a strong feature. And indeed, in our biennial symposia for health systems research, we call for submissions for both topics as well as methods. And methods are a strong feature of our exchange and conversation. And maybe brief reflection on the previous question. So what are the the benefits of joining? How do we join the HSG? I think Dr. Goran has already provided a fairly comprehensive answer to that, but maybe a couple of thoughts that the HSG is a society, even though we do have an organizational mandate. Pretty much all the benefits, they trickle down through to the members as individuals and the members' organizations. So in practical terms, that means that if unless there are specific programs that are at a community level, and by community I mean the network of societal level, if you like, the HSG as a society. So some of the programs are on publications, mentorship, for example, the organizational twinning. So those are by definition networking opportunities. But because of the platforms such as regional networks and thematic working groups, people actually use this as a platform to connect, to start speaking the same language and actually strategize and apply jointly for calls. Some of them were very comprehensively covered by Dr. Meyer earlier in the call, but there are others as well. Just from that perspective, I think it's important to recognize that HSG does not hold programs, if you like. All the research is held by the member organizations and members themselves. And the main benefit of the HSG is its convening power and the knowledge and exchange and mutual learning as a platform. I hope that answers somehow, because it's an important caveat, I guess. More recently, I think we have started thinking of some of the specific initiatives that may span across the boundaries of networking and the actual kind of conduct. For example, on the capacity strengthening, we have done a little bit of thinking within the capacity strengthening working group. We have developed a joint kind of framework and published that framework, but we did not really kind of implement this framework as case studies. So we are currently kind of looking for case studies of good practice in applying the comprehensive approaches to capacity strengthening. So this is just one of the examples where we kind of bridge the boundaries, but we don't really hold research within the HSG as a society. I'll stop at this point, and back to you, Professor Gotsadze.
Thank you. So before I go with the next round of questions, so it will be really great, like we have the participants online, and it would be great if they have some questions to you, so they could pose to you, and we have been asking them to ask the questions. So if they don't have questions, then it would be really great if they could say like 3 good or bad things they learned like today, I don't know, and in the chat, using the chat box, but like preferably good things. My next question is like, we have been talking about, and like I went on the HSG website right now, and I wonder if it's too expensive to become a member. So like, I recall, do you recall like what is the price for the membership? I used to know that like in my past life, but I don't know if the rates are same. While you're searching probably and checking that, so I remember like for me it was $30 per annum.
So it depends, George. It depends on the country, the income level of the country. If you are a student, and this is I'm looking at the website as well. This is not from memory. If you are a student, it will be a $60. From a low and middle income country, is the same fee, $60. If you are from a high income country, it will be a double, 120.
But it's probably 60 for 2 years.
2 years, yes.
For 2 years, 30 per year for low income countries, and it would be $60 for high income countries. Yes. Yes, Professor Mirzaev.
No, thank you. Yes, absolutely. I think you're, Goran, you found it much faster than I did. My internet is slower than your phone. So it is absolutely $60 for the 2-year period. And maybe one important kind of caveat is worth flagging up is that if you are considering attending one of the biennial symposia for health systems research, the registration fees for members are significantly lower than for non-members. So essentially, I think what we are encouraging colleagues to do, particularly if you are planning to go to Nagasaki, for example, to become a member and then claim lower registration fees. And I think that has a benefit to the society, but also to the individuals.
So, and you save a lot, yeah? So like
absolutely. I think it's the full membership fee plus I think it's about $50 extra or something of that sort. So it's in the grand scheme of things, it does make a difference. And maybe one last thing I wanted to mention on the membership is not everything is driven by the membership. For example, if you are not a member, you can still become kind of sign up to the newsletters from thematic working groups and engage in the conversation and exchange. And many colleagues actually do this as almost a tester, whether this is for them, whether the conversation kind of addresses the needs. And if you are considering, I think that might be one possible midway point, just seeing what's happening within relevant thematic working groups. And if it appeals to you, then please do consider becoming a member. Thank you. Back to you.
That's great. So I could even not join as a member, but like join the thematic working group discussions or sign up for the newsletter. I can get the information, monthly information or quarterly. I can engage with the peers, and if I like the environment, then I could join, pay for the membership, join it, and get even monetary benefits, not only a membership benefits. And so I saw there is a significant discount on publication fees. Like if I submit my article to your partner journals, so my scientific paper to your partner journals, I could also save significantly on those author publication charges that are so exorbitant these days, in case I don't have those funds like in my grant. So that's also true, yeah, for the members.
Yes, absolutely. So it's 50%, for example, off for the BMJ Global Health, 20% off for other BMJ British Medical Journal collections, 20% off the Biomed Central Journal collections. And I think there are also reduced fees for the health policy and planning open access too. So it's fairly significant.
Fantastic. Fantastic, great. So Maya, if I'm contemplating submitting like funding to EU or UK funders, the funders that you've described, so what will be like a foremost important step that I should take, or first three important steps that I need to take? So with the help of HSG or with the help of anybody here on this panel?
Yes, George, like for all calls, the main issue is to be like in line with the scope of the call, to select the relevant one, because like from those big range of topics, like it's very hard not to select the relevant. You will be able to select the relevant call in terms of topic. This is the first stage. The next step, it's definitely to find the relevant partners. For different reasons, partnership is encouraged by all funders, which I described today, and also partnership helps to increase the capacity for the participants from the less developed countries and less developed institutions, and also it creates the solid expectation from the for the funder that in case there are some lack of expertise in the team from the LMICs, it will be like sufficiently covered from other partners from maybe UK or partners from the Central Europe or other countries around the world. So the partnership is the next solid step, which needs time, which needs efforts, and you don't have to underestimate this because it's one of the most important part of that. And then it's all about the development of proposals, fulfilling the requirements and so on. But those two steps are the majors.
Thank you. So if I hear you correctly, Maya, so if I'm a researcher in any of these countries where I may not have the peers like in my own country or next door, so most funders would require my partnership with somebody across the border. Yeah. So yes. Most funders that you presented would also require for me to reveal what is the value of this partnership. And value of the partnership largely should rest either on building my capacity or contributing the disciplinary gap I might have in my own institution, because like health policy and systems research is more of a multidisciplinary field of science, which kind of calls collaboration of not only public health experts, but also health economists, like social scientists, political scientists, and others. So, and depending on the call and the theme I select, so that and that possibility could be realized not only looking at the funding opportunity, but also looking at HSG as a potential for me to tap on and easily secure the partnership. So would that be a fair conclusion?
Yes, yes.
Okay.
And even using the thematic working groups while posting that there is a possibility we're looking for like partners, you will see how engageful the thematic working groups are, and many people are responding and like offering their even, I don't know, expertise or their knowledge or their research ideas. So it's quite beneficial to be part of thematic working groups when you are dealing with the proposals. Over.
Thank you. So I've heard, like, I'm still watching the chat box, and unless I missed anything, so I don't see any suggestions or any questions. Am I right, or am I missing anything? Okay. So in that case, I've heard like you have one more poll that you wanted to run, Maya, and then maybe we just look at the polls and maybe earlier than planned close the webinar. So unless there are some questions that people would like to ask.
Yes, thank you, George. Like while we are speaking about like potential partnerships and funding opportunities, it might be interesting to see what are the research interests of our participants. And if you allow us, we can run the poll. Just short answers about your research interests in terms of field. We will dedicate a couple seconds to this.
Yeah, that's an interesting. So it's a free text. So wonder what might jump on the priority list in a word cloud, I hope.
Okay.
So
We are closing the poll. And Salome, if you can, please share what were the answers of the participants. It will be interesting just for us as well and for the participants. Okay, we don't see the long answers here.
no, we just need the word cloud there.
Okay.
So maybe.
Okay, sorry for the inconvenience. We will try to put the answers.
Okay.
Okay, thank you, everyone. Thank you for participating.
Now, I want to ask each of the panelists, so what is your ask to the final ask, like to the participants of this webinar? What would be the final message you would like to send to them? So just show the hands who want to start. It's like Goran, Tolib, or Maya, so who is willing to be the first? So, okay, Tolib, go ahead.
Yeah, no, thank you. Yeah, I think there are lots of benefits, mutual benefits to the individuals and organizations with regards to kind of engaging with health systems global. So my kind of plea would be engage, try it on, and maybe spread the word across other across your networks and organizations. Back to you.
Thank you, Tolib. So who is next? Maya, go around.
Okay, I will be the next. So we do believe in networking. We do believe in partnerships. The many success stories across the panelists you see now are built from those partnerships. And we do believe that if you will have, and if we will have some ideas, we can collaboratively deliver. On one hand, to increase the research production, and on the other hand, to strengthen the capacity within the region. So in case you are interested, join the HSG, join our LinkedIn group, and just you can directly contact us. So we are open to discuss, to speak, and looking forward to collaborations. Over.
Thank you. Yes.
So yeah, I think it's me next. So yeah, I don't have anything to add to that, except that if you are interested in learning about health systems around the world, HSG is your place to go. And you know, with that, it comes also the opportunity of experiencing different cultures, traveling around the world, tasting different food, experiencing, you know, different languages. I mean, I had the massive honor and opportunity to hear Spanish, go to Bogota and Medellin, and you know, Switzerland and Vancouver. So you go to amazing places, you meet fantastic people, you experience amazing culture, and you learn so much, not just health policy and system research, but so much more. And yes, please join the society, contact one of us if you have any questions, and we are more than happy to be your colleague, your partner, your friend. Yeah.
Thank you. So on that note, I'm sure like your presentation will be sent, and also participants will be informed in case they have questions, they would like to follow up with you all, like how they could reach you. So that's one thing is covered. Then my last bit in here would be like take home messages that what I've heard. So I think as a participant, an informed participant, I would say from your presentations, I've heard that. As a researcher, there is an opportunity for me to get the funding, and maybe I knew some, maybe not, but definitely there is a landscape of the funders who are interested in funding health policy and systems research. And if I want to fund my research and expand and broaden my knowledge about a subject matter, so definitely I should go and look for funders. But what I also heard that most funders would require me to partner with somebody, because rarely the funders that were presented would fund the research that is limited to one country or one research organization or one research team within one country. Most likely they would require for me to partner. The next I've heard that if I need to search for partners, like here is the HSG that I could go, which does not necessarily require me to upfront become a member, but I could explore the thematic working groups. I explore the potential for partnership, and if necessary, I could become a member, because the membership fees are not huge and significant, but even if they seem sizable to me, so the benefits that come, monetary or otherwise, are non-comparable to, and such benefits could be, first of all, like getting the significant discounts on the symposium registration. But if I'm not going to symposium and publishing my papers, getting the huge discounts on very significant author publication charges or publishing charges imposed by journals, for which with some you have like 50% discount, and with others like 25% that afford like huge benefits. And lastly, if I want to explore the world, I jump on the plane and go to different places that HSG organized the events to enjoy the culture, food, company, and I've heard that you guys run huge and fascinating social events at your HSG symposium. So, which is great to be there, to enjoy the society, dancing with peers, and also like consuming a moderate level of alcohol in a great company with a very, very interesting researchers, influencers in the research field, as well as policymakers and civil society activists that are also present in your symposium. So on that note, please allow me to thank you all. Give the hand of applause if possible. And on that note, close this webinar, and thank all our participants for staying with us and listening to our discussion. Thank you.
Thank you very much. Take care.
Bye-bye.
Thank you.
Bye-bye.